Speaker, my question is to the Premier. Last week, the Auditor General tabled her annual report, which further confirmed the Liberal government's stunning incompetence in managing our problems. Speaker, the Auditor General's report tells us that to get a bed at Ontario Shores Mental Health Centre, patients with the same diagnosis in 2015-2016 waited 3 weeks longer than 5 years ago. And those with borderline personality disorders who waited about a month and a half in 2011-2012 for outpatient services are now waiting 7 months. My question to the Premier is this: how can she continue to defend the outrageous increases in wait times that have happened under her government's watch?
Minister of Health and Long-Term Care.
Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker, and I particularly appreciated this chapter in the Auditor General's report that helped point the way for us to identify challenges in our mental health system, specifically as it pertains to our hospitals that provide that acute care for those with mental health and addictions. And she highlights areas that we need to continue to make improvements. For example, she talks about standards of care. Health Quality Ontario has already developed 3 standards of care in mental health for dementia, for schizophrenia, that will allow our healthcare providers in our hospitals to follow best practices. With regards to Ontario Shores Mental Health Hospital, I was particularly proud when we made the recent investment to open up beds specifically for individuals with eating disorders. We've increased the budget of the hospital by $2 million this year as well. Their operating budget, Mr. Speaker.
Supplementary.
Back to the Premier. Speaker, I've asked the Premier previously about cutbacks at Ontario Shores, and my questions have been met with Liberal spin from the Health Minister.
That's it.
And as the clock mercifully runs out on this government, the fact is its legacy of unprecedented scandal, waste and mismanagement has led to cuts to services Ontarians rely on. Since the Premier didn't answer my first question, perhaps she will answer this one. Will the Premier fire her Health Minister for the sake of patients at Ontario Shores?
Thank you. Minister of Health, Long-Term Care.
I'm not sure if I should be the one answering this part of the question, Mr. Speaker.
Just say no.
But no, I'm hearing a no. But Mr. Speaker, we recognize when it comes to mental health and addictions that there is a lot more work to be done. But I'm proud of the investments that we've made in CAMH and Ontario Shores and the Royal, which is in Ottawa, and Waypoint. We've made substantial new investments in those hospitals. And in fact, I need to mention that because the MPP for Barrie is there. Now I can see her. I was recently in Barrie just a couple of weeks ago where we opened a brand new, or rather we announced a brand new inpatient and outpatient youth and child mental health unit, which will be providing a number of inpatient beds at the Royal Vic in Barrie, as well as being able to serve more than 3,000 individuals on a daily basis. These are the kinds of investments that we are making. We know we have to not only reduce and eliminate the stigma, we need to invest more money.